everybody, Ms. Dietrich here. We're going to take a look at the Cardiology Virtual Lab, how to get started. So this link should be available to you either off the website or off of Google Classroom. So, hopefully you have no problem finding that. Once you get in, then you want to click where it says Launch Interactive. So let's do that, and let's see where it brings us. All right, so there are several tabs that you need to be familiar with at the top. They have the introduction, which you're going to read through. They have the tab that says patient. So once you get going, you're not going to see any patients until you're ready to start. You have something called the notebook. You have the various quizzes that you're going to be taking throughout the lab. Now, please don't worry if you get something wrong on this. You're not being scored on your results on this. You're just going to take a guess. And if you're wrong, it's going to tell you the right answer. And you just take that right answer that you get from the lab and you use it to help you with the quiz. So I would suggest having the quiz, the KIA quiz that is, and this open side by side and have them, do them kind of together. Now, probably one of the most important tabs is this tab right here, which is the reference tab. And you really need to become familiar with this diagnostic tools guide because this is going to help you quite a bit. And then, of course, you want to read through or click on all of these to know about the anatomy, the glossary of cardiology terms. All of this is good stuff, good reference stuff. But let's take a look at the diagnostic tools and become familiar with everything. Now, if you were actually a real cardiologist, these are the tools that they use. And I'm an actual patient in a cardiology office, and my doctor has used all these tools on me. So let's learn about them, shall we? All right, so the first thing is just the idea of listening with the stethoscope, listening to the heart. And you probably have had a stethoscope used on you at some point. So you'll read through all of this, and they give you some images of what the heart sounds like. But most importantly, you get to listen to what the heart sounds like. So these are actual problems of the heart and what it sounds like when a doctor holds a stethoscope up to the person's heart to have a listen. So when you click on it, it'll tell you, or I'll hear it. So there's that. All right, and then that's the aortic regurgitation problem. And then we have mitral regurgitation. So you learned, if you've been studying the anatomy of the heart, you know that there's something called the aorta, which is that huge, gigantic artery that takes the blood away from the heart. If the blood is sort of squeezing back in the wrong direction, that's what regurgitation really means. It's kind of going the wrong way. And it might be because of a problem with, the valves that are in there. So there's a mitral valve that we learned about. That might not close properly. And if it doesn't close properly, then stuff can sneak back in where it's not supposed to be and kind of go backwards. So let's have a listen to that. Whoops. All right, and then there's the stenosis, aortic stenosis. Read the definition of it, and let's have a listen to that. All right, now I'm not sure how well you could hear based on, the microphone that I have here. It's probably not adequate. If you listen yourself with your earbuds, you're going to be able to get a much better sense of what that sounds like. Now, your first patient, you're probably going to use that stethoscope right away to see if you hear any of these problems with your first patient. And you're going to want to go back to this and be able to have a listen and compare it, because it's going to be constant comparing your patient and these potential problems. And if none of these seem to be the problem, like if you're listening to the patient's heart and none of it sounds like this, then maybe your patient doesn't have any of these three problems with their heart. All right, so at the bottom, you still have your tools down here. You can either access them down here or at the top. So since we already took a listen, let's talk about the next tool that a doctor may use to diagnose their patients. So it's the idea of getting a visual, like actually looking, using this tool to see. And they show you, see how it says RV, that stands for right ventricle, left ventricle, right? Left aorta. And then down here, the ventricles have the V's. So this is really upside down, when you think of it. The ventricles really point towards your feet, and the atrium would be at the top, The pumping happens down here, and it squeezes it, into the top part of the heart, the atrium, we call that. All right, so this is just an image that a doctor can take, and sometimes they can have like a video image, like it's a live image that they look at. So that's what it looks like. And then they have this Doppler imaging, which this is what it looks like. And it's nice that they can actually take an image of the heart and see it live and happen. Now, when we use this idea of ultrasound, right? I had this done on myself, actually. That's a little bit different than the idea of the Doppler, because the Doppler is a little more, I think they get a little more information by using the Doppler echo rather than just the regular ultrasound. But you do need to know that using sound waves to create images, that all falls under this category. All right, next we have the ECG. Let's take a look at what that is. That's another tool that's commonly used. Basically, they kind of map out the sinus rhythms of the heart, and they give you all the information about the different parts. There's the P wave, there's what they call the QRS complex, the T wave, so you just find the letter, the U wave, right? These are all things that happen for a typical heartbeat. And then when the heart contracts and releases, that idea of repolarization, the heart restarting and starting the cycle all over again. So you would read this and know that they can take this measurement. Now, interestingly, my watch that I wear, I have one of those fancy watches, and it does have the ability to take this kind of map, if you will, of the heart rate. And I kind of pay attention to that because I'm a patient myself at a cardiology office, and I'm able to record that, and I can even send that to my doctor. All right, so there's the idea of the ECG. Let's move on to MRI. MRI is magnetic resonance imaging. So you can read about it here, but just you need to know what it looks like. They put you in this big machine that looks like a big tube, and then they're able to get these really nice, clear images of the heart. And again, V stands for ventricle, right? And A stands for atrium. So they're showing you the left ventricle, left atrium down here. Or if you look at this image. So read about what you're looking at here and know that we can take a really clear image of the heart and take a look. All right, and then lastly, there's the idea of doing a pedigree analysis. We learned when we studied genetics about pedigrees. We learned that if we just use this as an example, you have this set of parents. So we got dad and we have mom. Dad has the heart condition. And if we look at their children, so we have a daughter, we have son number 3, we have son number 5, and daughter number 7. And if you take a look at the offspring, so they had 1, 2, 3, 4 children, and 3 out of the 4 children inherited this heart condition. So that looks like it's a dominant trait, right? The dominant allele that probably causes this heart condition. So geneticists use this to make predictions about the next generation. So if you look at this set of parents here, so this daughter got married and they had 2 children, and 2 of their children have the heart condition. Now, we also can have recessive with a heart condition. So recessive traits, if you look at this set of parents here, they both had the trait, and that's, when they both have the trait, they can easily pass that on to their children. But if you look at, where did these parents get the trait from? Notice that the people ahead of them in the previous generation did not have the trait. So that's evidence that it might be recessive. All right, so we've talked about pedigrees before. That shouldn't be anything that's new to you, but just know that all the tools that you have, so if we go back to the introduction, you can at any point, click on reference and go back to those diagnostic tools, and you have them at your fingertips right here. All right, so if we go back to the introduction, you're supposed to read all that and go on to the next thing. So when you're ready to see your patient, you have to click here to enter the lab. It'll take a moment to load. All right, and then I'm just going to hit the start over button. All right, so it says, welcome to the Howard Hughes Medical Institute's Cardiology Lab. To assist the doctor with a patient, click on the door to the exam room. So see right here, here's the exam room. We're going to click on it. All right, now, once you've had a listen, remember in the reference, you were supposed to kind of have a listen to all the different sounds that the heart makes. So see, here's question 1 right here. You would read it. When a doctor uses a stethoscope, what is being monitored? And you would want to read all this stuff. All right, so let's look at A. The sound made by the electricity spreading through the heart. B, the sound made by the vibration of the heart and blood as pumping occurs. C, the sound made by the contractile molecules of the muscles of the heart as they contract. Or D, none of the above. So let's say you're still not sure. You've gone through this stuff and you're really not sure. Just, take a guess. So let's say you think it's B. Let's click on B. Let's look at question 2. Which of the following conditions can cause irregularities in the sound of the heart? And they give you a bunch of just different choices. Moderate bradycardia, mild mitral valve regurgitation, mild atherosclerosis of the coronary arteries, or both A and D. Again, if you're not sure, you've used the reference and you've looked this stuff up and you're not sure, let's just, take a guess, right? Because we're not going to stress over it if we're wrong. But if there's irregularities in the sound, maybe it might be, maybe the mitral valve is not closing properly. So let's guess B on that. And what is a murmur? So again, if you don't know what a murmur is, you can go to the glossary and let's take a look and see if murmur might be in there. You want to look and see, is it in there? Look for it in here. And if you don't see it in there, we can go to some of the basics and see if we see anything about it here. By the way, this is a really good thing for you to kind of look at before you kind of get rolling with things, because it does show you, how these valves, look at how that video really helps you understand how those valves close. But if we look through all the goodies here, the glossary, there's the encyclopedia at the bottom. You would want to look to see if any of that information, if they have anything that would help us to know, what that is. Also, I should mention that in the slideshow that I created for lesson 4.2, it does give you more information about some of these conditions. So, after doing extensive research, if you're still not sure, if we go back to the our introduction here, and we go back to this quiz here, because this is the quiz that we were in the middle of. Let's look through the choices. A rumbling or blowing sound that is made by the heart, often by malfunctioning heart valves. A wheezing sound made by the lungs, particularly during pneumonia, that may be superimposed over the heart sounds. C, a clicking sound made by the artificial heart valves, especially when there's a failure in such devices. Or D, a low frequency sound heard as venous blood fills the atria of the heart, which is pronounced during heart attacks. So let's say we think it's A. All right, so I'm just going to click on that, even though it might not be right. Now, the reason that I want to point this out to you is because you don't want to stress when you do other quizzes in this lab. Don't stress over it. You just hit your submit quiz, and it'll tell you the answers. So for number 1, we were right, that B was right. But look at question 2. So if we didn't know what it is, it ends up that it's not B. So does it tell us the right answer? It does. See, it says the correct answer was D. So actually, it was both A and B. So these two things were both true for number 2. So we make a note of that so that when we do it in the Kia quiz, we get it right. And then we click done. All right, so we're presented with our first patient here. And he's a male, a 55-year-old male. We will perform a preliminary stethoscope exam to listen to the patient's heart. Click the patient to continue. So we'll click on the patient. All right, to listen to the patient's heart, move the stethoscope over the patient's chest. To change views, click an image in the views window. All right, so let's hold it over and let's have a listen. All right, now, does it sound normal to you? It might not be, right? So we have to maybe go back and hit up those references so we know what those various problems that we can listen for, like a regurgitation, for example, of maybe the aorta or the mitral valve. But what do you think? So does the heart sound normal? Does it, or do we have one of these other problems going on? So let's say you think the heart is normal. If we hit submit, see it's saying that it's not normal. So it's showing a diastolic murmur. So we should probably listen. See, that's a diastolic murmur that we're hearing there. All right, so we would make a note of that, right? And this kind of shows the image, and they show you the murmur right here. We would want to read about all this. All right, and then when we're ready for our next scenario, you have completed listening to the heart. So now we need to do further tests. So let's go to the echo room, and the echo questions are right here. So, you would read through the questions. So I'm not going to do this with you. You're going to do it on your own. So read the questions and pick what you think it is. And if you're wrong, don't stress over it, because if you're wrong, it's going to tell you the right answers and you just make a note of that. Don't forget, some of these questions that you see in here, some of the same exact questions will appear on that KIA quiz. So it's not a bad idea to take occasional screenshots and maybe put them on a blank Google Doc, or just have the quiz open so that you can kind of answer them as you go. All right, so a couple reminders. You're going to go through this whole thing because you have several patients that you have to see. So we just saw patient number 1, or actually this is patient C, but I think you have a total of 3 patients that you're going to be working with. You'll go through the various quizzes. And if for some reason you want to save your progress and you have to step away from your computer, then you would want to click on sign in. This will save your progress. Click on your school account and then, hit allow and all the things that'll, another window will open up that'll ask you to click on a few things before it actually saves your work. But if for some reason you're a little nervous about having your information be available to, this biointeractive stuff, if you want to protect your privacy, then don't save it. Just try to plow through it and get it done. But you will have to start over if you don't save. All right, so I'm going to recommend that, you just kind of plow through, give yourself a good chunk of time to get through it. Now, once you feel like you've gone through it, then you will have listened to used all the tools that they talk about, and you'll feel a lot more comfortable to take the quiz. So I just want to remind you about the quiz. So let's see if I have that here. It is right here. This is the quiz, and it has a lot of the same questions, and it asks you to recognize some of these images that we talked about. Now remember, slideshow 4.2 on the heart is another resource that you're going to find helpful to help you answer these questions. But when you click that submit button at the end, it's not going to give you the answers. The answers are available in this lab. All right, so good luck finishing this up. And again, don't stress over your quiz results in here, because it's not being scored in here. It's being scored in this. And you can take this as many times as you want to. All right, good luck finishing this up.